Hi, I'm Dr. Greg Grillo with Express Dentist, and I'm here to talk to you a little bit today about the things that people actually fear when they go to the dentist. We all know that there is some anxiety. The majority of people feel some anxiety when they go to the dentist, but it doesn't always stop them from going. But what is it that they actually fear? And what causes that anxiety? It turns out that there are some very, very specific things that do that. It's not just one thing. It could be a combination, but for most people, it does come down to one identifiable thing, which the research has shown is the case. And this fear can be high enough that it may keep up to half the population from going to the dentist, or they delay treatment. And so if we can identify what the fear is, and as a patient, if you know what it is, then it helps you find a solution that's workable for you so that you can actually get in and get the care that you need. So let's dive in and look at what those 5 identified fears are, again, from psychology research. Number 1, it's the fear of losing control. So you think about this, you go to the dentist, it's a very vulnerable position, even for just an exam. You're actually laying on your back with your head back and your mouth open and your arms down by your side. I mean, it doesn't get much more vulnerable than that. Then you have treatment providers that are, right up close and personal. And so it can be this real sense that you really don't have control. And that can lead to a lot of anxiety. And so if that's identified, then what's the solution? Usually it's to share it with the provider and to establish a protocol for letting the doctor know when you feel like you need to intervene. And just that sense that you can put your hand up, for example, and the dentist will stop, and you've established that with them, that can give you a sense of control. It can help you overcome that fear that you're losing that. And number 2, of course, it's the fear of drilling, the sound of that high-speed drill. So most dental drills move at about 300,000 RPMs, and they're driven by air. And so those air turbines do produce a very significant high-pitched noise. In fact, a lot of dentists have high-end hearing loss, the research has shown. And I can attest to that. But that sound alone can create a significant jump in blood pressure, certainly a jump in anxiety. And so how do you deal with that? Headphones are great. Some offices use noise canceling headphones with music. And these days, with your phone, most offices are going to be just fine. If you want to bring it in, bring your own headphones that you're comfortable with, and noise canceling headphones can even be just a little bit better. It's not going to totally eliminate the sound because it is very close and personal, but it can make a significant difference if that sound really causes a lot of anxiety for you. And number 3, this is pretty straightforward, the fear of pain. I mean, nobody wants to hurt, and there is a concern that dental procedures will be uncomfortable. And there's really no reason for that to be the case. I mean, sometimes there can be, a little mild discomfort or pressure, but nothing that should make you feel like you're in pain. And so, these days, most providers are very in tune with that. And if they're not, then you probably should seek out another dentist. And some of the anesthetics that we're using today, the modern day anesthetics, which are not Novocaine, they're much more advanced than that. They actually absorb extremely well. So they get into the nerve tissue much better, and they can create a very profound numbness. And so a skilled provider not only understands you and how you feel about that, but they know how to control it and to respond to anything that's a problem. So that's one that can certainly be overcome, again, just by sharing with the provider and letting them know. Number 4, it's the fear of choking and also the gag reflex. So you may know you're prone to gagging. You may know that even brushing your teeth causes gagging, or that the placement of a dental x-ray sensor causes a gag or a choking feeling, or if you're laying on your back, that water is going to cause that sensation as well. So again, this is something that's very important to share with your dental team. There are techniques to help with gagging, some very interesting ones. If your provider doesn't know about this, you might ask for it. That is the use of a little bit of table salt on the back of your tongue. You can just sprinkle a little bit on that. We don't exactly know how it works, but it actually works really well for most people. And they're surprised to find that it knocks down the gag reflex significantly. That, some of the suction devices we use today can really help keep the water out. But share this again with your provider. And then number 5 is the fear of dental equipment in general, just all the things that we use. I mean, it is a very unique environment. We use hand instruments, and of course we talked about hand pieces. This is separate from that, from the sound of the drill. This is really the fear of dental equipment. So just looking around at everything that we use may cause a little bit of anxiety. And so that is sometimes hard to avoid, but your dentist should be pretty good at just keeping things discreet, and most importantly, keeping things comfortable, as we talked about, because that fear of pain that we mentioned really ties into fear of shots, and we recognize that people often are very concerned about that. And so the fear of pain and the fear of dental equipment, they kind of go hand in hand to tie together for that fear of a shot. But again, with the anesthetics we use today, some of the gel anesthetics we use and the slow techniques, most people should be able to experience an injection that is really much more comfortable than they expect or that they've experienced in the past. So, these are 5 very identifiable fears that people have about dentistry, and they're very real, and you shouldn't feel otherwise. And I think the important thing is to share this with your dental team. They want to know, and if they don't want to know, or you feel belittled or that you're not being listened to, then it may be time to find a new dentist. Here at Express Dentist, we have a trusted network of dentists and specialists across the nation, and we can certainly help you find a provider that you may feel comfortable with. So if you're ready for a new provider, or it's just been a while since you've been to the dentist, maybe dental fear or past experiences kept you away, it might be time now to make an appointment, get in, and see somebody that you feel comfortable with, and be sure to share any of your anxieties and identify the specific reasons why you're anxious, so they can help tailor and personalize your experience for you. That's really what we love to do. So thank you, take care of yourself, and all the best.